Okay, I have Ken Casey here. He has a full code with no known allergies. And today we are gonna go ahead and insert that NG tube. So I have all my supplies here. So we're gonna go ahead and go to the patient's room.
Come in.
Hi, I'm Savannah. I'm gonna be your student nurse today. Is that okay?
Yeah.
Alrighty, I'm just gonna go ahead and just provide some privacy here. And I'm just gonna move your table out of the way a little bit. And then can you tell me your name and date of birth?
Yes, Cam Casey, 12919XX.
Perfect. And then I saw in your chart that you didn't have any known allergies. Is that still correct?
Yes.
And do you have any allergies to the latex or adhesives?
No.
Okay. So I'm just gonna get you kind of lifted up here. So like I said when I came in, we're gonna insert a NG tube that the provider has ordered. It'll kind of help clear any of that obstruction that you kind of have in your bowels. So I'll do a few different assessments before we get started. And then we'll walk through that NG tube to get it inserted. Do you have any questions?
No.
Okay. Are you okay if I kind of lift up your gown and your blanket to kind of do a GI assessment?
Yes.
Okay. Move this one out of the way a little bit. And then, can you tell me when your last bowel movement was?
Oh, it was a couple days ago.
A couple days ago. And then was it hard, soft? Was it diarrhea?
Oh, it was very hard.
Very hard, okay. And then, kind of get that stopwatch going. Can you also tell me if you're passing any gas at all?
No, I don't think I am.
No? Okay. I'm trying to get my stopwatch to kind of go. There we go. Got my stopwatch. All right, so we're gonna go ahead and I'm gonna listen to your stomach, okay?
Okay.
feeling your tenderness with any of that? Still feel okay, no pain or tenderness?
No.
Good, okay. Alrighty, I'm gonna switch you up a little bit for respiratory assessment. When was your last bowel movement?
A couple days ago.
Okay. And any pain or tenderness you're waiting in, abdomen, nausea, anything like that?
No.
Okay, good. Alrighty, and I'm just gonna listen to your lungs, okay? So I'm trying to feel my stethoscope, but I want you to take a deep breath in and out, okay?
All right, Cam. You did have some hypo bowel sounds, which I did listen for that 3 minutes. So I'm gonna go ahead and just kind of palpate. Can you just tell me if you're feeling any tenderness, or if that hurts when I push down at all?
It's a little tender.
Just a little tender. Okay. I do feel that small indentation with that obstruction that you got. Okay, so we'll go ahead and get you covered back up here, and then I'm going to go ahead and I'm going to listen to your lungs. So I will have to expose your chest a little bit for that. Is that okay?
Yes.
Okay. So I'm going to get you uncovered here. And then while I'm doing that, are you experiencing any coughing, wheezing, shortness of breath?
No.
No? Okay. So when I do this, I'm going to have you, I'll let you know, I'm going to have you just breathe in and breathe out. And I'm going to listen to the front of your chest, and then we'll help you sit you up, and then I'm going to listen to your back of your chest too, okay?
Okay.
All right.
Lungs sound clear, okay? Sometimes coughing, are there any issues with
Have you breathe in
coughing, shortness of breath?
and out.
No. Okay, good. Alright.
Breathe
So I'm
in.
gonna leave you out like this, okay?
Breathe
This is
out.
a little bit for this procedure.
Breathe in. Out. In.
Okay.
Out.
Hand sanitize.
In.
And we're gonna be in, okay?
Out. In. Out. In. Out. In. Out. Okay. Your lungs sounded pretty clear. They sounded equal on both sides, so I'm gonna go ahead and kind of help lift you up some, okay? All right. 1, 2, 3. All right, we're still gonna do the exact same thing. I'm just gonna have you breathe in and breathe out, okay? All right, breathe in, out, in, out, in, out, breathe in, breathe out, breathe in, breathe out, breathe in, and breathe out. Okay, those sounded pretty equal still. All right, help you lay back down here. All right. And I'm gonna go ahead and also check your mouth and your nose. Have you had any trauma relating to your face at all?
No.
No? Okay. So I'm gonna have you kind of open that mouth for me. There's no redness, there's no sores. Alrighty. And within that nose, it does look clear. There's no redness. The skin around looks good. And the septum does look intact. So I'm gonna go ahead, I'm just gonna check for which nostril will be the best one to put it in. So I'm gonna go ahead and close one side of your nostril, and I'm gonna have you breathe in and breathe out, and then we'll do that with the other side too, okay?
Okay.
All right, so I'm gonna have you breathe in and breathe out. Okay, jet the other side, breathe in, breathe out. Okay, so this one on this side does look like it's a little bit clearer. So we're gonna go ahead and do that side, okay?
Okay.
All right, so I'm gonna go ahead and kind of get all my supplies ready. Do you mind if I use your bedside table for my supplies?
Go for it.
Okay. so I'm just gonna place this on your chest here. Alright, so when we get started here, I'm gonna go ahead and I'm gonna measure the tube and mark it so we know where we need to get it placed, okay?
Okay.
Alright, so by doing that, I'm gonna go to the tip of your nose, to the back of your ear, down here. Okay, I'm gonna mark it at about 56 here. So I'm gonna mark that off with a piece of tape. Alright, so when we get started to do this NG tube, it will be a little uncomfortable, and you will experience some discomfort, but it should not be painful. And so if it becomes too unbearable where you need me to stop for any reason, I'm just gonna have you go ahead and raise that left arm up to have me kind of just stop. And if you kind of keep raising it upwards, I'm just going to continue to pull it out and we'll be done and we'll try again in a little while. And it will be expected to gag once we hit to the back of that throat there. I'll have you as kind of a sip on water, and then when you swallow, I'm gonna kind of keep pushing that NG tube down further to kind of help a little bit. And then once it gets placed in, I'll kind of secure it a little bit, and then we'll kind of check everything and then send you down to x-ray, okay?
Okay.
Alrighty. So I do have your water here. And then go ahead and get this kind of all moved out here. Alrighty. Alright, are you ready?
Yes.
Okay, I'm gonna get it all looped up here. Alright, so I'm gonna have you breathe inwards. I'm gonna have you breathe out. Alright, so it is not coiled back there. Alright, so I'm gonna have you take a sip of water, and then when you swallow that, I'm gonna have you tilt your headward, your chin downwards a little bit, okay?
Mm-hmm.
Alright, swallow. Alright, are you experiencing any chest pain or dizziness at all?
Mm-mm.
Okay. Almost done here, you're doing great. So I'm gonna go ahead and mark it here since we're kind of getting that resistance, okay?
Okay.
So we're at about a 54. Okay. And I'm gonna go ahead and kind of just temporarily place it on your nose so that I can pull back and then check those juices. Okay. Okay.
Alrighty, so I'm going to do a GI assessment on you and a respiratory assessment. So I just want to raise you up and then lay you down a little bit, okay?
Okay, so that has a pH level of 4, so that looks great there. I'm gonna go ahead and get it kind of just secured down to your gown and then send you to x-ray, okay?
Okay.
Okay. All right, so you came back from x-ray and they confirmed placement for us. So I'm just gonna go ahead and get that tape re-secured to your nose and kind of redo it there.
Okay.
And then I'm going to also then provide some oral care for you too, okay?
Okay.
Okay, so let's take that tape off here. Okay. And then it's still gonna be marked at that 54, okay?
Okay.
All right, so we're just gonna make sure that you don't pull on this NG tube at all. And then while you have it, you are gonna be hooked up to suction here soon. So I'm gonna have you always hit that call light if you do need to get up to use the restroom, because you can easily trip over that and it won't be any good, okay?
Okay.
So I'm gonna leave that call light here for you. All right. And then, Cam, are you okay if I go ahead and do that oral care, or do you wish to do it yourself?
Oh, I can do it myself.
Do it yourself, okay. All right. Well, I'm gonna at least hand you everything so we can get that taken care of really quick too, okay?
Okay, thank you.
All right. So here is this for you.
Thank you.
All right, I'm gonna have you kind of spit it out there. Perfect. I'm gonna have you damp that a little bit. Alrighty, okay. I'm gonna get you lowered back down here, and then I just want you to let me know if there's anything else I can help you with after the fact, and then that NG tube will kind of help relieve some of that pain that you're having too, okay?
Okay, thank you.
Yeah, get this all taken care of. And then here is that table for you.
Thank you.
All right, you just let us know if you need anything, okay?
I will. Thank you.
Alrighty, of course.